Hello, everyone, and welcome to our Thursday keynote speaker portion of the Business Forecast Conference. I'm Stuart Waldman, President of VICA. We hope that you enjoyed the election breakfast panel this morning and all the great panels that we had. I know I had fun in a couple of mine. Before we get started, I just want to remind you that there's a raffle drawing at the end of the event tomorrow. We've only got 26 people qualified right now. And you get points for visiting exhibitors and downloading a file or setting up your profile or posting a picture and a couple other things. There are really cool prizes that include a Rams jersey and Southwest Airlines tickets. So please join me in thanking our presenting sponsors of the conference, Southern California Gas Company and Wells Fargo. Also, we'd like to thank our keynote sponsors, U.S. Bank and the Walt Disney Company. Now let me take a quick moment to thank a few of our other sponsors. Our co-sponsors, Comcast, NBC, Universal, The Garland, Los Angeles Daily News, San Fernando Valley Business Journal, Southwest Airlines, our track sponsors, the California Alliance for Renewable Energy Solutions, CARES, California Lutheran University, Clear Channel Outdoor, Kaiser Permanente, Viacom CBS, and a big thank you to the rest of our sponsors, advertisers, and exhibitors as well that helped make this event a success. You can see all of them in the event journal by clicking on the button on the homepage for the journal or on the exhibitors and sponsors pages. In these trying times, VICA really appreciates the support of our members, and it's great to see so many companies who find this event important. I also want to remind you to join us at the conference happy hour tonight at 5:30 p.m. Staff have given you some drinks that are our favorites that you can make. And now I'd like to introduce the chairman of our board, Brad Rosenheim from Rosenheim and Associates, who will introduce and interview our keynote speaker today.
Thanks very much, Stuart. And thank you all for attending this great event today. I can't wait for tomorrow, but before we get to tomorrow, we have a great keynote speaker and a great happy hour planned for a little bit later today. So let me introduce to you our keynote speaker for this morning. Beth Andersen is the president of Anthem Blue Cross and oversees the management of Anthem's commercial business and strategy in California, working collaboratively with local and state elected officials to help transform healthcare. No doubt a simple job. Prior to becoming president, Beth was vice president and general manager of California Large Group at Anthem Blue Cross. And before joining Anthem, Beth served as Senior Vice President of Enterprise Solutions at Optum. She also led an ancillary and digital wellness company, both owned by Cambia Health in Portland, Oregon. Prior to these roles, Beth held a variety of leadership positions at Aetna, where she last served as president of the company's West region and had oversight for all lines of commercial business spanning 11 states. Beth has served on the boards of several digital companies, including Wildflower Health and Mobiquity. Beth received both her master's in business administration and bachelor's in economics at the University of California, Berkeley. Please join me in welcoming Beth Andersen. Beth, thank you very much for being here today. And of course, the applause is all very virtual. So let's get started. Beth, what are the three main trends impacting healthcare that you're seeing in the market as it relates to providers, the employers, and the members?
Great. Well, first of all, I just want to thank VICA for having me here today and for the opportunity. And I just want to point out that the tagline, adapting and overcoming in a post-pandemic era, has really resonated with me, because that's exactly what I've been doing personally, and we've been doing at Anthem. And so hopefully I can bring a little of that flavor here today based on your questions, Brad. But the three main trends, I think the biggest trend that we've all seen is the shift to and the adoption of virtual care solutions like telehealth, We kept talking about telehealth in the industry for years now. And then all of a sudden COVID hit and it just accelerated the use of telehealth in ways that we only could hope for, based on an unfortunate circumstance. But one of the things that we saw that I think the audience might find interesting is that the shift was huge. So for primary care visits, evaluation, and management, from January to April, that's our second most common use of telehealth. Our visits jumped 10,000%. I had to double check my numbers. So we went from 2,800 visits in January to over 300,000 by the end of April, which is staggering. So people still wanted care, just in a completely different setting or to make sure that they were all right. And then the most common telehealth visit that we had historically is behavioral health. And that jumped about 2,000% to over 400,000 visits by the end of April. And, that's come back down now that providers have opened up their bricks and mortar offices, but it's still at a higher level than we've ever seen before. And I don't think we're going back. And that's particularly true for behavioral health visits. There's many practitioners that got used to doing this online and felt it provided the degree of intimacy that they had in their offices. And they're actually saying that they're going to prefer to have a majority of their visits online. So we continue to see that at a high level, and we'll continue to support that. And I think you'll see other types of care being practiced in a virtual setting with device monitoring equipment like scales, stethoscopes, thermometers, and things like that. So that's one. And then you asked about three. So the other one is continuing shift for affordability. Unfortunately, the pandemic has caused a downturn in the economy in California. And we were on a path to move to more affordable care options from, we're in a fee-for-service environment where you're paid on utilization, providers are paid on utilization, trying to shift towards value based on total cost of care, high quality, and efficiency. And so we've been seeing an acceleration in trends to get to that value-based type of care arrangement. We're fortunate in California. We have a very strong HMO delivery system, and that's probably as far to the right in terms of value-based care as you can get. But we're talking to many more providers to try to have more value-based, less fee-for-service, just to manage long-term cost and sustainability, both for the providers, so that they have revenue at a constant level, which is what happened with HMO, which was a good thing, as the office visits declined, and then to get that high value. So affordability is one, and then the other is just much more simple and on-demand type care. So telehealth and virtual care is one aspect of that. The other thing that we're seeing is the use of artificial intelligence, whether it's through healthcare apps, other third-party apps. You see that in symptom checkers. Like if you had to get a COVID test, they take you through all these different levels of testing, and how you answer takes you to another screen or another series of questions. Online appointment scheduling with your providers. So we're starting to see that. And then serving up at the point of when you're trying to figure out if you're going to go to the office, the doctor's office, urgent care, and hopefully not the emergency room for non-emergencies, just serving up different alternate types of care, including telehealth. So I think you're going to see a shift on to digital, much more so than you have in the past. And I think COVID has accelerated that shift in many ways. The other trend that I think will be really interesting for your audience, and this is a new one for me, and I've had to have a crash course in this, is historically, insurance has covered things that are medically necessary. And that's what it's based on. And we don't cover things that are based on occupational health. That's been workers' comp or, at the discretion of the employer. But there's been two examples brought on by COVID. One is emergency regulations that required health plan coverage for COVID testing for essential workers, even folks that have no COVID symptoms whatsoever. And that's occupational health testing. So that's been a huge change from things that are, based on medical necessity. And then the second is the passage of Senate Bill 1159 that treats COVID-19 cases as a workers' compensation industry, and it creates this rebuttable presumption for purposes of disability benefits and payment of medical claims. So that means that if you contracted COVID-19, it's presumed that you caught it at the workplace, even if you might not have. And, you know, and that depends on the classification of worker. Police, firefighters, healthcare workers, home healthcare workers fall under that provision. But then there's this second provision that applies to all workers, and it's based on an outbreak within the workplace and subject to employer. And that law went into effect July 6th of 2020, and it goes through January of 2023. And that really changes the way the reimbursement to providers, and also changes who pays for those medical claims. So in this instance, it shifts it away from health plans and onto workers' comp carriers. And then the COVID testing obviously is shifts directly onto health plans. And, you know, I'm not going to comment on the policy provisions of it because I understand those and we're in a unique time, but the resulting impact is going to be an increase of costs either on your workers' comp premiums or in your healthcare premiums. And so it's just really important that employer groups and, you know, businesses understand that, because that's a huge change that we've never seen before. But again, we're in unique times that we've never seen a lot of this before, but that's a huge shift. And hopefully it begins and ends with the pandemic, and it's not just, you know, there's not a creep factor that it's going to, you know, change the way things are in the future. So I think that was 3. I think I answered.
That was 3. So it sounds like some of these may have been a surprise to you, and I'm presuming there are other surprises that have come out of COVID as we've sort of adapted. If I'm correct, how has Anthem been able to address them most effectively, given the current circumstance and these unforeseen circumstances?
So I think, you know, obviously the pandemic was a surprise. This regulation's a surprise. So we've had to put in all sorts of changes in terms of having enough, you know, testing labs and sites, you know, available for individuals, changing our claim systems. I mean, this is really complex stuff, complex enough to understand the regulation and then put it into practice. And so it's a Herculean effort to make that all happen. And then there's some things that weren't necessarily surprises, and they've always been there, but COVID brought them to the forefront. And one is just, we all know that there's a disproportionate access to healthcare in different communities of color, and there's been racial inequities in healthcare. And COVID has really exacerbated that, whether it's COVID's hit different communities differently in terms of the rates of COVID. And then, you know, for Anthem, that means that we're trying to be much more proactive and address those inequities up front. And that goes anywhere from addressing food insecurities. We partner with food banks across the state to make sure we address food insecurity, providing access to resources for addressing homelessness. We're working with the YMCA and other organizations to make sure that we provide free flu shots in locations that might not have access to primary care or hospitals, urgent care centers across the state. And so we're taking that very seriously, and we're really looking at how we can help address inequities in the communities in which we have members and in which we serve. And that benefits, you know, Medi-Cal lives, Cover California lives, as well as, you know, commercial lives too. It just, so there's no cost shifting, that there is this common underlying access to healthcare that's available for everyone. So that's probably been the one. The surprise is the legislation, but you step back, it's not so surprising. But, and then the other is what's always been underneath the surface, and now it's come to the surface.
Well, I guess in some ways it's good to surface some of these issues, and it certainly seems like Anthem has been able to adapt to that very well. So in the course of adapting to all this, as we are on a different platform. We're on Zoom right now, and we came from a different platform and going back and forth. I presume you have had to adapt with your technology as well to address these and improve the health outcomes, and also to reach your members and for them to reach you through telemedicine. So can you talk a little bit about those technologies and how you've been able to employ those?
Sure. So, telehealth is one. So we have our own telehealth, access to telehealth through our own vendor. But then we have reached out proactively to the provider community. Many of those providers have their own telehealth capability. We've always supported it and reimbursed them for that. And then we're offering those that might not have that available access to other telehealth vendors. So if their patients don't want to come into the office, they can still have outreach and meaningful visits with them. And then we've also supported we have an app called Sydney. It's what we use to communicate with our members. So we have accelerated things that might have been on our roadmap. One is appointment scheduling with certain providers, and we're just starting to put that into effect. And so you can schedule an appointment for an office visit or even a telehealth visit. And so we're going to do much more of that. We find that members like that easy access. I think the other thing that we've done is we've accelerated the use of artificial intelligence, whether it's in a chat, like you chat on an app with a chat box to get you to the right answers sooner. We're also using artificial intelligence, and we have a wealth of data, analytical data, to identify individuals who might be predisposed to certain chronic conditions like diabetes or asthma, and make sure that we connect them with programs based on their personal preferences, with doctors, with the right prescriptions. And if they have gaps in care, like they haven't filled their insulin prescription, and we might know they're a diabetic, we'll make outreaches and text them saying, you haven't filled your prescription. Are you okay? What's wrong with you? And just really provide that connectivity either directly from Anthem or else working with their primary care physician and making sure that they're connected so that people have access to care when they want it, how they want it, and then just trying to engage them in the best way possible. And what we're trying to do with digital means is replicate to some extent. If somebody doesn't want to use an app, they can pick up the phone and call, and it should be the same experience as it can be the same based, digital versus telephonic. So we've been spending a lot of time on those efforts. The other thing that we've done is when COVID hit, we were working with hospital partners on ICU capacity, is we developed this tool called C19 Explorer. It's available to the public. So we took all this different publicly available data. You can drill down to the community level, and it allows you to pinpoint outbreaks of COVID, underlying conditions in your community, hospital bed capacity for ICU. And we found that many employers have used that to help plan return to work in their communities or return to school. And it's just, it's available to anyone, and it's very easy to drill down on the map to your county. And it just provides a wealth of information that was in all different silos, and we just brought it all together so it could be used as a planning tool.
That's fantastic. So if I get a message from Sydney asking me what's the matter with me,
you should answer.
It's not the only person that asks what's the matter with me. So Beth, can you give us some insights? We constantly hear and we experience issues related to the cost of healthcare. And of course, that's a big issue in the election cycle right now. Can you give us your thoughts on what's really driving the cost of healthcare?
So there's a couple of things. I wish it was one single thing I could point to, because we would then focus on it and solve it. So it's a lot of things. I think some of it, I recently had a medical emergency last week, and I had to spend 3 hours in the emergency room. And the number of people that aren't aware that they can have a primary care physician or there's an urgent care center, but to show up in the emergency room for care is really sad in a way, because it's the worst place for you to go because you're around a lot of sick people and you have to wait a long time and the costs are astronomical. And, so I think some of it is making, whether it's individuals that have employer-based coverage or are on the exchange or Medicaid, aware that there is access to primary care, how to access your primary care physician, so they can provide guidance in terms of making sure you're utilizing care in the right way to get you to your optimal health. And they're not a hindrance to care. I really am a firm believer in primary care and how you can use that physician to help be an advocate for you and to guide you, not be a gatekeeper in any way. Versus, and then also there's urgent care centers. They're much less costly alternative than emergency room use. But what we see is, unfortunately, even though it's gone down somewhat, we still have way too high volumes of folks using the ER in lieu of an office visit. Like if you have a high fever. And so I think we need to do more as an industry, and we're trying and educating individuals that that's not the appropriate setting for an emergency room. And that contributes to, cost shifting in all sorts of ways. And then I think the other thing is specialty drugs. So the cost of specialty drugs is it's great that there are these all new drug regimens to help cure these, very chronic, serious diseases. But they only treat a small percentage, yet they account for, and I want to look at my numbers here, 45% of all drug spend. That's huge, and it's going to rise to 52%. So I think it's not only working with pharmaceutical companies to lower the cost of drugs, but it's also having a very clear idea about specialty drugs and implementing programs that provide improved drug use efficiency. So you have the right drug, you get it from the right place, and you have it administered at the right site of care. Because not all drugs need to be administered in a doctor's office. Some do. Some could be administered at home. And there are different avenues for obtaining specialty drugs. And so we're in discussions with providers around that, just like other health plans. But that's an area that we really need to get focused on, just because it's starting to take represent a bigger percentage of the total healthcare spend. So those are some of the drivers. So education, access to primary care, not use the emergency room, and then a focus on specialty drugs.
Very interesting. So we obviously are seeing an economic impact because of COVID. And how is this impacting actual health coverage? What are you seeing trends related to health coverage and how people are being served?
Yeah, we originally estimated when we saw that, the economy take a turn for the worse, in California, we were expecting a significant decrease in covered employee lives. And thankfully, we did not see that decline happen as much as we anticipated. I keep waiting every month, and I hold my breath, and it's been better. So that's good. Hopefully it'll continue that way. And I think in California, unlike some of my peers in other Anthem states, we're really fortunate in California to have the safety net of Cover California and the tax subsidies, because we've seen a significant uptake in membership growth through Cover California. So we know as small employers are having to, either go out of business or lay off, and even large employers, there's access to COBRA coverage, which could be costly, but then they can go on Cover California. And we've seen double-digit growth in Cover California lives. And then for those that can't even afford that, we've seen a significant uptake in Medi-Cal enrollment. So we've seen these safety nets. They do work, and they are safety nets. And, we've provided programs that you can call an 800 number and try to figure out what works best for that individual. And we've seen an increase in the use of that 800 number as well. So we can guide folks to the right coverage. And I think that the other thing that we're focused on and we started to put plans in place, and I wish we would have done it 2 years sooner, is employer groups are saying, you know, we want to make sure we have affordable, lower premiums. And so we're willing to give up access to these very broad networks of doctors for a steeper discount. So we're working on creating, I call them curated networks in partnership with providers to provide that much lower price point. And it could be anywhere from 15 to 23% less than a full network. So it's substantial. And then provide those along with virtual care options and some other things, digital care options to the extent they make sense. And I think those combined together will create a compelling change, you know, for in 2021, 2022 and beyond, and we'll continue to iterate on that.
So that's something that we'll see continue to progress post-pandemic. Are there other initiatives that you're seeing either through employer groups and or through your side, through Anthem, that we can expect after the pandemic?
Yep, I think that one of the things, you know, kind of got lost in the pandemic is there's whole emphasis on wellness. And so if there are wellness programs that we used to cover flu shots, obviously we'll still do that, but there was, you know, on-site wellness coordinators, so that we've all had to adapt to digital coaching. But I think that employers are looking at how we have wellness in this post-pandemic era, because many of us might not go back to the office for a while now, at least until there's a vaccine. So we're focused on how we deliver wellness and what it means and how we deliver it individualized to each person instead of these broad brush programs. So it could be focused on, you know, exercise that's meaningful to you. It could diet programs, nutrition programs based on your individual circumstances. So we're looking at very much creating personalized programs. So it's the personalization of healthcare in a different way. And so we're piloting different programs. We're piloting with Apple and an Apple Watch asthma programs with large employers and seeing what those results are and seeing how we might use these devices, including your phone, your iPhone or an Apple Watch, in order to have real-time data and feed that back both to the individual and perhaps their provider, and, you know, measure if it's improving their health, both from their own perspective as well as from, you know, a clinical perspective. So we're going to see many more pilots and programs like that across a wide variety of chronic conditions.
That's fascinating. I noticed when I put on my suit for the first time in 7 months that I could use some nutrition help.
You're not the only one.
Can you talk a little bit about COVID testing and then the various vaccines, what you're hearing and what you expect to occur over the next many months related to that, and then the therapeutics as well?
Sure. So I've unfortunately, because of the pandemic, I've had a crash course in different types of COVID testing and now getting versed in the vaccine. But, you know, I think that employers and others agree that we need low cost, accurate, rapid testing so we can get kids back in school and, you know, people back to the office and the economy going back. But it's not so easy. And same can be said for vaccines. It's how do you distribute that COVID testing? What's the appropriate frequency? And there's a huge range of debates and opinions on that, you know, and it varies by age group and, you know, where you work, what type of industry you're in. You know, we're partnering with, you know, CVS, the Walgreens, different labs, but we've been very focused on innovation. And some of that is focused on, originally it was, you know, the PCR nasal swabs, you know, the long ones, short ones. And we're now looking at home kits, whether they can be saliva-based testing. They've gotten very accurate lately. And the use of home tests that, you know, are least costly, and making those available. So people don't have to stand, you know, in line. And originally we had the drive-through clinics, and those will still be there. So Anthem, along with other Blues plans, participate in something called the X Prize Pandemic Challenge. And so what it was focused on coming up with a $5 to $10 test, that includes everything, that was rapid and accurate. And so we had 700 entries from 70 countries that participated. We narrowed that down to 200, and we're in the final phases of testing on synthetic virus. And then those will be narrowed down even more to where we're going to do some pilot site testing, testing with live viruses. And it's just been amazing the amount of innovation in a very short amount of time that's out there, whether it's from universities, research labs, and then startup companies around testing. And, and there's other tests too that are going to be coming out very low cost that I just talked to our testing lab area today, and it's called co-test. It doesn't have a name yet, but when you go to test for the flu, they're going to test you for the flu and COVID-19 at the same time, and they're rapid tests, very low cost, which is amazing because you don't sometimes know if you have the flu, it might look like or feel like to you have COVID. And so we're going to work with just different variety of companies to try to get that out there from a testing standpoint. And then the vaccines, we're going to cover the vaccine. I think recently CMS just came out this morning or last night with some new instructions about waiving co-pays for vaccine. But then if it's a one-shot vaccine or they're saying it's going to be 2 shots, how do we get that out there? How do we get everybody tested? And so I think that is going to be a true public-private partnership effort to get that done using a variety of means, and having to deploy just different resources and thinking outside the box like we never have before. And we don't have all the answers, but we're going to be working closely with Department of Health and Human Services, the governor's office, and myself and my health plan colleagues to figure out the way to do that and to track people. So if it's a two-dose thing, you got it once, okay, now you need to come back and get it twice. And so we're not there yet, but it's something that we're all getting focused on now. At the same time, we're still trying to figure out all the testing nuances at the same time. So.
Well, it seems like a very complicated process to break out. Are you expecting it to be at a county level, or will the directives come from the state level or the federal level down to the local level to actually implement?
I think it'll federal level, certainly. And then at the state level, the governor, along with some other Western states, I think Oregon and Nevada, are going to want to do some testing on the vaccine before they roll it out. And then we'll have to work most likely with the county health officials to figure out the best way to get this out into, into our communities from a vaccine perspective. So we're going to have to, we've always partnered, but now I think it's just a different level of partnering, and because the scale it blows my mind to think about it. It's massive.
Yeah, it is a huge undertaking, but seems like you've got it well underhand as it's moving along. And our time is up, and I just really want to thank you, Beth, very much for taking time to share some of these thoughts with us. This is very spear of the arrow stuff that we need to, or a tip of the arrow stuff that we really need to be dealing with. And your insights have been very helpful. Obviously, at this point, you would hear great applause, but as with our discussion, COVID has made that very difficult. But on behalf of VICA and all of our members and those of us joining today, I want to thank you very sincerely for taking your time and sharing with us. I'd also like to thank our keynote sponsors, US Bank and the Walt Disney Company, as well as our presenting sponsors, Southern California Gas Company and Wells Fargo. Let's also recognize all of the generous sponsors of the 32nd Annual Business Forecast Conference one more time. Thank you all very much. We look forward to seeing you tonight at the conference happy hour and hope to see you again tomorrow. Have a good day. Stay safe.
Okay, thank you, Brad. Thanks for the opportunity.
Thank you. Bye-bye.
Bye, everyone.